Hey everyone, thanks so much for joining us here on episode 6 of Mountain Movers. I'm excited to have a colleague of mine, Dr. Brenda, here. Dr. Brenda actually went to chiropractic school with me, and she also did nutrition through the same college, I believe. And I always knew Dr. Brenda is the girl to go to when I had a GI issue because she's just so knowledgeable and so passionate about nutrition. And for my practice members, you know that I really just focus on chiropractic, and I'm excited to have Dr. Brenda as a nutritional resource because I know so many of us struggle with nutrition. And she's going to be talking to us today about irritable bowel syndrome, which I think we've all heard that thrown around, but no one really understands what it is. So Dr. Brenda, I'll have you take it away. Can you tell us a little bit about why you're passionate about nutrition, what your mission is?
Yes, definitely. Thank you for having me. I was extremely excited and honored to be selected for the nutrition and the gut portion of this. So I really am happy to be here. So a little bit about me. I, like you said, went to the same chiropractic school as Dr. Amanda. We went to New York Chiropractic College, in which I also got my master's of applied clinical nutrition there as well. So I work a lot with nutrition in terms of food, but I do a lot of functional medicine type work too. So I run a lot of thorough testing, and I use a lot of supplementation, diet, and lifestyle modifications to treat whatever it is that's going on based on the results. I got into nutrition. I was always into healthy food. I obviously had my fair share of time where I indulged in things. We all went to college. We all, ate dining hall food and drank alcohol, right? And felt terrible. But for the most part, like I always had an awareness of like, okay, these foods make my body feel good and these foods don't. So then when I was in chiropractic school and we started learning more about nutrition, I think I really was like, oh wow, like this really has sparked my interest even deeper. And at that same time, I was dealing with horrendous gut stuff myself. So missing some class, late to class for whatever reason due to my gut, just not having the best quality of life. Like I would get like anxious when I would go to restaurants because I'd be like, I don't know what I'm going to eat that's like not going to hurt my stomach essentially. I then worked with someone who does what I do now, and I healed my gut and my quality of life skyrocketed, and it just led me into this like whole realm of gut and hormonal disorders and helping people where they feel like they are kind of at the end of the road, like they don't know where else to go or what else to do.
And I feel like this is so common in women. So my husband, he's a PA in the emergency room, and he says this all the time. There's always a young person, and most of the time it's women who come in with gut issues and everything comes back like clear. He's like, there's nothing we can do for them. So they end up with this like runaround. So I like that you talked about functional medicine. So basically, I think what you're hinting at is if you've had this runaround and you're starting to feel crazy about your symptoms, you're necessarily not crazy. You may just need a deep dive into what's going on.
Exactly. Yeah. A lot of the conventional tests, when there's nothing that shows up on those, they're not going to catch what you actually need to catch to figure out what's going on. So like, it's not in your head. You're not crazy. Your symptoms are not made up. They're real. You're just not getting the proper test to show you what is basically causing those symptoms.
So we would literally need to be on this call for 24 hours if we talked about every single gut issue possible. Can you tell us a little bit about like what irritable bowel syndrome it even is?
Yeah, so irritable bowel syndrome by like definition is you're experiencing anything along the lines of abdominal pain, bloating, gas, diarrhea, constipation, alternating between those two, cramping, and irregular stools, whether it's consistency, shape, color, frequency. But it's considered IBS when all of the conventional medical testing is negative. So colonoscopy, clean, whatever else test that they do, clean. I said colonoscopy, endoscopy, etc. So what IBS really is I like to call it a diagnosis of exclusion. So they give you that diagnosis when they do not know what is going on. So it's not really real, if you will. It's not like you have this because it showed up on this test with this exact finding and this is the medication for it. It's an exclusion diagnosis. We don't know what you have, but we know that you're having these symptoms, but everything is normal according to our tests. So that's what it is technically. What it actually is, though, is Typically, it's caused by things, but there's a lot of causes, but it's caused by things like improper diet. So you can, if you're eating a lot of like ultra processed foods, not a lot of whole foods, you can start to see, let's say, a lowering of your beneficial bacteria in the colon. And now you can start to see symptoms just because you now are not strengthening those good bacteria with foods that feed it. It can also be from things like a parasite or an H. pylori infection or a bacterial infection or like a small intestinal bacterial overgrowth. It could be a yeast like candida. It can be caused by medications like birth control. So there's a lot of actual causes, and there's a lot of different things that could be causing it that would still be considered IBS, if that makes sense. So like someone with a parasite compared to someone with a bacterial overgrowth, I would still say that's IBS. It's just two different,
So everyone's IBS symptoms are different based on the causes, but can also be where they are in terms of their age. So like pre/postmenopausal women can have IBS, but for different reasons because of their age group.
So when it comes to, this is kind of like a tricky question where I could like deep dive in a lot of different ways. When it comes to things like a bacterial, viral, or parasitic infection or a fungi or a yeast, that's not really age exclusive.
Right.
That can happen to anybody, but there is a deep hormonal connection and aspect to IBS as well. So you can have irritable bowel type symptoms, whether you're in your menstrual years or your postmenopausal years, and that can be from hormonal fluctuations or hormonal imbalances or whatever it may be.
I guess that makes sense. Are women or men typically more expected to get IBS, or does it really not matter?
Women actually are more common to have it.
Do you know any particular like reason why that would be?
I actually don't know.
And I'm just curious because, like, just going back to what my husband says, he's like, it's always women in the ER with stomach pain.
I think it has a lot to do with our hormonal fluctuation, and I think it also has a lot to do with how our food, lifestyle, and stress really affects everything about our bodies, including our hormones and our gut. And it also could simply be like a lot of men, I feel like, push things off. Like they're like
their tummy pain.
having this. Yeah, they're like, I haven't pooped in 2 weeks, but like it's fine, right? So I think there's partially like a biological and a scientific reason for it, but I also think a lot of it has to do with possibly them just like not being as. I feel like men aren't as body aware most of the time. Like I feel like a woman is like, I woke up today and I feel 10% off and I don't know why, and a guy's kind of like not as in tune.
I think that's so important to talk about, like men, just like in general, not with stomach pain, I feel like don't pay attention to their health very much. And I don't know about you, but I see this in practice all the time where it's like, okay, I've had this for 10 years, but now like it's debilitating and I want to do something about it. And it's like, where have you been the last 10 years? I think
Exactly.
it's a masculinity thing.
Right. Whereas like most women, they're like, I woke up this morning with this pain and I needed to get it checked out.
This is like our FYI to all men, like your body's important and it matters and you should probably pay attention to it.
100%. 100%.
So there's no particular like one size fits all for IBS, because I wanted to ask you about treatments, but just based on the conversation that we've already had, the treatment's really going to be dependent on what is causing your irritable bowel syndrome, if it's a bacterial overgrowth versus something else that's going on.
Right. So it really does depend. So like, let's say you have someone who shows up with these symptoms and I always do a stool test. It's my favorite thing to do because it's going to tell me what exactly is going on, like what is in there. So if you have a bacterial overgrowth and maybe you also, let's say, have some intestinal permeability and you have low beneficial bacteria, your treatment plan is going to look a little different than somebody who has a parasite, no intestinal permeability, but maybe they have intestinal inflammation and maybe they have, like pretty solid, good beneficial bacteria. So the treatment plan is going to look a little different for each of those people, but it typically looks something along the lines of eradicate the biggest, most threatening, if you will, pathogens. So like if you have a parasite, if you have H. pylori, or if you have a major virus or bacteria, and I'm talking like Salmonella, E. coli, etc.
Hmm.
Always get rid of like the biggest guy first. So you eradicate. If you have a bacterial overgrowth, you don't have a parasite or anything bigger pathogen wise, you would start with eradicating that. And typically, if they also need some type of digestive support at that same time, so let's say their pancreatic enzymes are low, you would put them on a digestive enzyme as well at the same time while you're killing it off so that we're digesting the food,
So
etc.
you do
And
this
then
mostly through diet or supplements or a combination?
a combination. So the supplements are going to be what, for the most part, are going to be what eradicates these things, right? So like these certain pathogens or bacteria, whatever it is, there's certain herbs that will actually kill them. But if you're doing that, if you're taking the supplements, but you're eating crap or drinking alcohol or eating a lot of sugar, you're kind of like walking up a down escalator. So the supplements will help you this much, but if your diet is not good, you are basically inhibiting your potential of healing. So a combination is best.
And you do both when you consult with people. You'll give them a diet plan and the recommended supplements.
Exactly. And typically with the treatment, like I personally do it in phases. If you are to work with someone and they are trying to do everything at once, it's not ideal. So we do every dietary changes throughout the whole way. Big kill first, any type of support that they may need. If there's someone who's constipation dominant, we got to make sure that they're pooping, because if they're not pooping and we're killing, they're going to feel terrible. So some type of like motility support. And then typically it's just basically like repairing. So repair the intestinal lining, boost up those beneficial bacteria, get that inflammation down, etc. So there is an order, and it does take a while because each step, depending on how severe your infection is, if you will, it takes a couple months each step. So it could be, it's a commitment, but it's
Worth it.
honestly like,
We just talked about the investment, which is health, right? I'm not sure. There's an argument to say that anything is more important than your health and wellness. You and I talked last year when I had C. diff, and it was like when your health is debilitating, you can't go to work. You can't go do fun things, especially not with C. diff. You can't eat whatever you want. So it's like really important to focus and invest in your health. So a few months isn't bad.
Right. And there's something to say about quality of life too, right? So like a lot of people, I think they think it's normal to like only poop 3 times a week and be bloated after certain meals, but like it's not. And you don't have to live that way, and you don't have to go on vacation and, avoid all these things or feel so terrible. Like that's not how you have to live, and that's not how our bodies are meant to function with food. There is a reason why you're feeling that way. And if you think about it, like I always think your body is your true house. Your house is just your body's house, right? So like if you're going to spend X amount of money on your roof, why aren't you spending X amount of money on your body's roof? So it just, to me, your body is the one vessel that you have throughout your whole life. So if it's not basically working optimally, then if you can't enjoy your life because your health is not optimal, you can't enjoy the house that you just put the new roof on. You can't enjoy the vacation that you just paid for. So it is an investment.
Why do you think it's so hard for people to prioritize that and prioritize their body?
I think that's a tough question, because I think that a lot of people have different reasons for it. But I think that a lot of people, especially women, are used to putting themselves on the back burner, right? Everybody comes first. Everybody comes before them. They're the caretaker, whatever it is, a mom, a nurse, etc. And they have bills, right? They have to pay their mortgage. They have to pay their utilities. And so I think that people look at health care as a luxury rather than a necessity. But I've thought about this plenty of times. Like, I know a lot of people who, let's say, get their nails done every 2 weeks. And if that's something that you do to make yourself feel good about yourself, okay. But let's say, I don't know, that's probably like $120 a month, maybe. That's something that, like, if your symptoms are that bad, you can cut that out and you can put it elsewhere. If you buy a $5 coffee 3 times a week, that's $15 a week. So that's however much money that is a month that you could be putting towards your health. So there are things I think a lot of people don't realize, costs that they're putting money towards that aren't actually necessary, that they can cut out if needed. But I do think it's looked at as a luxury. Like I think, for instance, like massage. I feel like people think massage is a luxury because it's usually expensive. But you and I both know that that's a necessary thing that people need to do
Yeah, I
to
always
make.
say at a certain age, chiropractic, massage, nutrition is no longer a luxury, it's a necessity. And I feel like we're at that age
Yeah,
now.
right. Like you would never just like go to the gym once a month if you wanted to be healthy, right? Like you're gonna go multiple times a week. So like it's, or you're not going to drive your car and not get an oil change. It's like that's basically what these things are. That's what
Yeah.
a massage is. That's what an adjustment is. That's what nutrition care is. So,
So like circling back, what are the most common symptoms with IBS that aren't just stomach pain? Because I feel like I see IBS symptoms all the time that people aren't really recognizing.
yeah, so it's not always pain. So oftentimes it could be bloating with no pain. It could be constipation, which isn't always painful. You could have painless diarrhea. You could have acne. You could have eczema. You could have fatigue after eating. So there's a lot. You could have joint pain. Like that is a big one too. A lot of people who struggle with things like gas and constipation usually have low back pain. So it's not always intestinal
Mhm.
symptoms, but it could be in your skin, it could be in your sleep, it could be in your nails if you're not like absorbing nutrients. You could have striations or divots in your nails. So there's a wide array of symptoms and
Is
signs.
there any connection? Like I see a lot of women in my practice that are doing their best, right? They're getting some cardio in every week. They've cleaned up their diet, but they're still having a hard time losing weight. Doing the stool samples and the consultation for nutrition with you. Do you think that would be beneficial for them?
Yes. So typically, women with stubborn weight, we're looking at two possible things that could also be both for each person. So definitely some gut imbalance or dysbiosis. Because let's say you have a parasite, right? If you have a parasite and your body's constantly trying to fight this off, your immune system is heightened. So your body's not going to try to lose weight because, quite frankly, it doesn't care. That's like the least of its worry. Or it could be a hormonal imbalance. Like a lot of women who have a hard time losing weight, maybe they have high testosterone, maybe they have estrogen dominance, maybe they have really high cortisol because they're so chronically
Mm-hmm.
stressed. So it's typically, obviously, it could be other things, right? Like maybe you could have heavy metal or mold exposure or something like that. But those are two pretty heavy hitters, the gut and the hormones, that will cause something like I'm doing all the right things, but I just can't get rid of my belly fat or whatever it
And can
is.
you help them with their hormonal imbalances as well?
Yep. So I do. I also work with women for hormonal issues. So for gut, I do a stool test. For hormones, I do a urine test. It's called the Dutch Complete. And it sets itself apart from blood tests because the blood test is going to show you, are you producing the hormone? Which, if you're still having a period, you are, right? The urine test is going to tell me what your body's doing. Is it breaking it down? What are the metabolites looking like? What does your cortisol look like? Are you favoring active cortisol, inactive cortisol? Are you breaking down your estrogen into a healthy pathway? Or are you breaking it down into a cancerous pathway? So I do a lot of work with that as well. And then, a lot of women I see are candidates for both gut and
Sure.
hormone. Honestly, myself as an example, so I started having gut things again. And I was having hormone things that I was trying to figure out. I did my Dutch. I started treating it, was still having a persistent symptom that was indicative of like low progesterone. So I was like, this just doesn't make any sense to me. So I did a stool test. I said, okay, I'm actually going to do this for my gut while also tackling this specific part of the hormones. Do that first, wrap back around to the hormones and see if that affects it. So you can absolutely have more of a complex issue where your gut is contributing to your hormonal imbalance and
Oh,
vice versa.
interesting. Let's end with some advice. I know it's like, we need way more details and time, but if someone wants to start being better about their nutrition today, are there any
Mhm.
things that you can recommend that they can start doing immediately?
Absolutely. Yeah. A couple simple ones would be stop drinking liquid sources of sugar. So take your sugar and your creamer out of your coffee. Don't drink those sodas. Don't drink those energy drinks. You're just consuming excess sugar or artificial sweeteners that are wreaking havoc on your gut and your hormones and just your overall health. Trying to actually limit this one, I might get trolled for, but it's fine. Trying to limit your dairy, honestly. So dairy, I don't have a problem with dairy. I have a problem with American dairy. So like a lot of the dairy sources in America are very inflammatory. The cows aren't treated right. And you see a lot of these like fitness influencers being like, make this high protein, whatever. And they're like slamming it with cottage cheese. But that's going to cause a lot of women, not so much men because their hormones aren't obviously quite the same, but that'll cause a lot of women to hold on to this weight that they would otherwise drop. And really prioritizing your protein. Like it's not a fad, it's not trendy, it's legit. Most Americans are overdoing carbs and underdoing protein, which is just causing absolute mayhem for their blood sugar. Going to give you energy crashes and fatigue and cravings. So take out those liquid sugar calories, take out or reduce your dairy. If you're going to have it, make sure it's imported from like Italy or something, and really up that protein. Those are 3 simple ones that you could start with. And obviously hydrate.
I'm sure we can all do that. Sweet. Awesome. Thank you so much. Can you tell us how people can reach you if they wanted to start nutritional consulting?
Yeah, definitely. Probably the easiest way would be on Instagram. My handle is dr. and then my last name. So
I'll put it on the screen
VILN.
for them too.
Yep. That would probably be the easiest way. Send me a DM. I'm the one that controls my Instagram, so I answer people. I'm very active on it.
And you can do all the stool samples and stuff like virtually?
Yep. So basically, if you decided you would maybe want to work with me, you would schedule a free consultation. It's 15 minutes. You basically tell me what's going on. I give you details on what I do and what I think you'd be a candidate for. And then we would select the program based on your needs. And then if you don't live in the same state as me, I will ship you the test. And they get shipped back to the lab, and then I get the results, and everything is virtual.
Awesome. So it honestly sounds pretty easy. I love it. Nowadays, how everything works.
Yeah, there's only a couple states that are a little weird with the test shipping. I think New York is unfortunately one of them, and I think Rhode Island is one of them too. So there are ways to get around it, but that's like one of the only like barriers, if you will.
Awesome. Well, thank you so much for taking the time to do this. It's super helpful and resourceful. So I appreciate it.
Of course. Thank you for having me. I appreciate it.
Of course. Thanks so much for joining us here on another episode of Mountain Movers. Let's take control of the nutritional portion of our lives and use our struggle to springboard us into the life that we want. Our nutrition not only affects our weight, but our mood, our energy, and so much more. Let's move.